Good morning, I'm Nicolas Marin, and today I'm gonna present my healthcare plan for the United States. To understand, we gotta talk about the Affordable Healthcare Act that we have right now in the United States, which was enacted in March 2010 by the President Barack Obama, with three main problems that the United States had. People didn't have access to them because of the highly expensive healthcare system they have. For this reason, he tried to lower the cost for all households with an income in between 100% and 400% of the federal poverty level. Additionally, he tried to expand the Medicare, the Medicaid that he had, to all households under the 138% FPL. Additionally, he wanted to support innovation and the new designs that people were coming up for the new distribution systems they had for the healthcare in the United States. As every system, this has had benefits and had some disadvantages. However, this healthcare system had a huge positive impact in the United States. For example, when this was enacted in 2010, the 22.3% of Americans were uninsured. However, after 4 years after specifically, just 16.3% were uninsured, which means 20 million people had access to insurance. Here you can see the graph of how the uninsured drastically went down after the Healthcare Act was enacted in 2010. Additionally, this gave a lot of access to people, which increased the quality of life for them. Therefore, the life expectancy increased too, as patients with renal disease, cardiovascular disease, or health failures had access to it, and less people died. However, it also had some drawbacks, as everything. One of the biggest drawbacks were the deductibles that people had. Before, the deductibles for insurance were decently low. However, with this new act, they actually went up. Individuals had deductibles as high as $8,150, which is really, really high. In terms of families, the family deductibles were with a limit of $16,300, which shows how expensive healthcare is still in the United States. Additionally, there were not enough doctors in network. There is a lack of supply. The price of premium was also higher. So yes, people had more access to insurance, but still the costs were way too high for healthcare. We also have to understand the history of healthcare in the United States to make an effective system. Everything started with Theodore Roosevelt when he developed the first organized healthcare in the United States. He truly believed that a country cannot be strong if their people were sick and poor. He started developing the insurances and how the healthcare system worked. The private insurance that managed most of the market share by that time was AALL bill. The Congress by that time then passed the War Risk Insurance Act in the World War I, which ensured healthcare for all soldiers. After that, in 1930, the Social Security number was introduced to be able to provide healthcare to everyone. However, the AMA opposed drastically to a national healthcare system. Why? Because they said that everything had to be privatized and money must be on top of everything. Something that for healthcare cannot be the best thing. Then the Social Security Act of 1935 protected all the elders and retired people, so more people were having coverage. In 1940, they enacted the employer-sponsored healthcare. Therefore, if you work for someone, they should provide healthcare. In 1950, medical advances and technology started increasing, which started to increase the cost more and more. After this, the Congress started to do a lot of things in order to desprivatize the healthcare. However, this was not possible. Insurance companies had too much power in the market, which created almost like a monopoly, and the government could not do anything about healthcare to reduce the prices and the costs. I want to talk about Canada's healthcare system to compare it to the United States, which I think Canada's system is one of the best in the world. Canada's system is decentralized, universal, and publicly funded healthcare system. What does it mean? That the government has most of the power on the system. Everyone have access to it for a low cost or even for free. Each state or province, how they are known in Canada, manage their own healthcare with certain standards that the government has in it. The government have all the primary responsibilities such as financing, organizing, distribution, and any other area healthcare needs. Here in this chart, you can see more or less how the system works. It's very complicated as the government has to pay attention to a lot of factors that play a role in efficiency, effectiveness, and quality of a healthcare system. So I want to present a new plan for the United States. But why? Why do we need a new plan? Because healthcare should be for everyone. Everyone in this country deserves quality healthcare, and it's something that we don't have. Thanks to the high cost, a lot of demographics, because of their income, even age, sex, don't have access to it. I think healthcare should be accessible for everyone, no matter what. Therefore, I want to promote a system that will help fight this problem that we have. Additionally, a big problem I see here from someone that is not from the United States is that money drives this industry. And I think healthcare should be more about the people and less about how much money are you making. So what am I proposing? I'm proposing a universal healthcare. What does that mean? According to the World Healthcare Organization, the universal healthcare refers to having access to healthcare, to the basic healthcare, for everyone, whenever or where they desire or they need. How we're gonna achieve this? With a huge role of the government and a mix of public and private insurance companies to provide the best quality service possible. Okay, let's talk about the role of the government in my proposal. The government should manage all healthcare systems, distribution, and services. They must have standards on how the money is distributed, how the service is provided, and have a clear path of how the United States healthcare should do. They also should monitor all the suppliers, including medicine, drugs, technology, rooms, beds, anything. The government has to be there checking is the highest quality possible. The government should also fund physicians and all the programs they have for healthcare. But because the United States is very, very big, I believe that the most efficient way will be like each state manages their own healthcare system with certain standards and specifications the federal government gives to them. We're gonna increase budgeting of the healthcare. by putting more money on the budget and also hiring taxes to be able to fund this new system. We are going to talk about insurance. Here in the United States is a big thing, something that maybe in other countries is not. So I would propose a mix of a public healthcare insurance and private healthcare insurance, something that they can work together to provide the best quality. The public healthcare insurance will provide, as it says, insurance and service to all the services that are not in the main services that are being provided by the government, which includes dentists or even vision care, for example, more specific services. This can increase the government income and revenues to be able to fund this new system and all the people that needs healthcare. Also, we're gonna talk about the private insurance role in the system. We cannot take the private section and area from healthcare. Always having a private company will help increase the economy, speed it up, and maybe have more efficiency. Therefore, this private insurance is not gonna be like in the United States right now, where all healthcare services or everything is based on this insurance. However, there are gonna be offerings for people that want more, maybe better services, private rooms, go to the dentist, that is something that is not going to be covered by the government, or go to rehabs, or go to psychiatrists, or go to more specific services that they need. For this, is the private insurance is going to play a huge role on this, which can speed up the economy and have a better efficiency of the system. The workforce. This is very important for the quality of a healthcare system. So students should get a medical degree in public medical schools that the government gives. Why? Because this will give a standardization of quality and knowledge for every physician and medical provider. Students should have their practices in urban locations and also in non-urban locations to have an experience of wherever they're gonna treat. This ensures a high supply of physicians, a high supply of nurses, and a high supply of providers to have the best quality service in the country. Specialists, however, should be self-employed, have their own sector. As I said, they are gonna be included in the services the government is gonna provide. The hospitals play a huge role on the healthcare system. So how is this gonna work in a universal system? Well, it's gonna be a mix of private and public administration and management of the hospitals. However, most importantly, they are gonna be non-for-profit organizations. As I said already, healthcare should be for the people and not for the money. They are gonna be managed by delegated healthcare authorities that will have to be developed to ensure the quality and services provided. And they have to operate under annual global budgets. So the government is gonna be a budget for every hospital depending on demand, service provided, prices of the area, inflation and everything. Based on that, they do a budget, and the hospital will have to follow the budget that is given at the beginning of the year. However, a lot of misunderstanding can be on quality. People say, okay, public might be bad, they're not gonna give the best quality service. However, we can ensure quality by giving tools and measurements for every hospital and healthcare service and provided to make sure they are following the standards and performance goals that we're setting. So we're gonna give the balance scoreboard tool to measure the efficiency and give an evaluation of the performance that the hospital or service is giving. We also will have a specific strategic plan on the operations of hospitals and services. They have to follow a certain plan on how to operate, and this will ensure efficiency and quality. Okay, now we're gonna think how is gonna be the support for this. Well, this is not easy as we're changing drastically the system to something more public and less privatized. But I believe this is gonna be supported by both parties. Why? Because I know leaders seek for the wellness of their population and their people. If they want the best for their people, they want everyone to have the best healthcare possible. And the option I'm giving is not a bad idea. Economically and in terms of finance, is viable as I've seen a lot of countries such as Switzerland or even Canada or the UK that are applying a similar system from what I'm proposing, which shows that if the money is budgeted and managed correctly, they can provide a good service. Obviously, as everything, sometimes there are gonna be some conflicts of interest. Some politicians will have a lot of money on the healthcare system or even insurance system, which they will not like to support. But I know that this will increase the quality of the American population, which I know everyone should support. Okay, how is this gonna affect the supply? Well, it will have a high and huge impact on the insurance industry. Right now, all healthcare is based on the private insurance. However, this new service and system is gonna be based on public, mostly. So the prices of insurance are gonna go down. Not many people are wanna go into the insurance company, and the supply of private insurance will slow down. However, the government has to ensure that this decrease of supply by private insurance is going to be compensated by the public supply of insurances. It's a drastic change in the system, but it has to be done periodically, and this will provide a better service. Okay, the effect on demand. This is very important. I believe people sometimes don't go to the doctors, or they don't check their illnesses, or they don't do what they have to do in order to get better because of the high cost healthcare has. So I know for a fact that having free healthcare or low cost will jump up the demand of this service, which obviously will increase revenue. However, it's not gonna be much because of the service provided. But the government has to make sure like the high demand is gonna be matched up with a system and a flow and a chain that will provide that is not everyone at the same time. So we have to ensure a system and a strategy that will help provide the best quality. Also, we'll have better customer satisfaction as they are getting quality service for a low price. Well, to conclude, I'm providing this universal system as the solution for the high costs we have right now. The government will play an important role in managing and budgeting all the money, services, distribution. People will be more satisfied with the service, and we will have a better life here in the United States. Thank you so much. Here are my references.